Hey everybody, super excited to be joining Cate Faulkner here today from our Division of Substance Abuse Services. Cate, what is your official title with the department?
So I'm a program manager over overdose prevention in the Office of Prevention and Early Intervention.
Awesome. So your business card is a 4x6 card and not the normal.
Right.
Yeah, because you got to get that title on it. Talk to me about what you do and how you do it. Because it seems like your work is really on the forefront of where Tennessee's at in the overdose crisis and overdose deaths and that sort of thing. Tell me a little bit about that work.
So I have the joy and privilege of overseeing the Tennessee Save a Life program. And so what that is our department's response to the overdose crisis in terms of prevention and overdose prevention in particular. So what that looks like is the work that community providers are doing that focuses on training, education, around the overdose crisis and its applicable tools. So it's talking about recognizing and responding to an overdose, how to administer Narcan or naloxone, and it's also really focusing on reducing the stigma of substance use and helping communities be more open and understanding of substance use and overdose in a way that support people who have substance use, who've overdosed, at risk of an overdose, for being able to reach out for help, getting supportive care, being able to talk about their experiences rather than that being a place of shame and where people can't talk about that.
Yeah, that's awesome. You've been with the department a little bit more than 5 years. You just hit 5 years with the department. And specifically, your work with the overdose response has gone in phases, several different phases. Talk a little bit about the change that you've seen in overdose and how that's morphed and kind of where we're at today with that.
So Tennessee has obviously been hit hard by the overdose crisis. When I started in 2020, we were very much at the beginning of the fentanyl impact. And so what fentanyl is a very potent opioid, which makes it a lot easier and faster to overdose. And so between that and kind of the isolation of the pandemic, we really saw a huge uptick in overdose deaths in 2020, 2021, into 2022. And so a lot of our work has been, how do we educate on that? How do we get more resources, more work into the community that's going to reduce those overdose deaths? But then also, it's not just about kind of that huge uptick. Every overdose death, every person with a substance use disorder is somebody's loved one. And so we want to make sure that it's not just focusing on the crisis part of it, but not losing touch of the real and impacts of people and communities every day. So as we think about how the overdose crisis has changed over time, so have our programs. So we continue to see the need for a range of services, a comprehensive approach. And so, you'll hear people talk about, oh, Narcan's the answer. We actually don't feel that way. We feel like we need a comprehensive strategy that involves training, education, stigma reduction, connection to resources. And so we've got these regional overdose prevention specialists that are out in the community, and they're doing that training, education, connection to resources. They're doing street outreach, they're doing formal presentations, they're connecting with community agencies, they're working with first responders. They also are the point of distribution in communities for naloxone, or what most people know as Narcan, which is the overdose reversal medication. We've also added testing strips, first with fentanyl test strips and now with xylazine test strips. And what those are just a small piece of paper. It kind of looks like a pool testing strip.
Yeah, like a pH strip.
pH strip, yeah. And so people can test and see what's there. And so what we see is that folks are concerned about fentanyl, or they're concerned about xylazine. And so they can test that and say, oh, you know what? This has this in it, and I'm going to change my behavior. So that was a really exciting development, adding testing strips to our range of services. And then the more recent addition to that has been adding care coordination.
Right.
And so what that looks like is people who have that lived experience of substance use, these are CPRSs, certified peer recovery specialists, are serving as that point of contact between a first responder and all of the other treatment recovery resources that are out there. And so I love working with peers because they're able to connect with people who are in the throes of addiction in a way that clinicians or first responders or other people really have a much harder time doing it. And so they provide that vital linkage between first responders who are overworked, stressed out, tired of dealing with the overdose crisis. And those peer support people say, hey, you know what? You did the initial response. Let me do the follow-up and let me help provide linkages into those other services. And so that's been a really fabulous addition to these services. So it's not just kind of the proactive preventive parts, but it is also how do we support people who have recently overdosed, who've been at the scene of an overdose, who are using substances, and help them take those next steps, whatever those are for that individual.
Yeah, that's awesome. You know, you talked a little bit about you know, the individual versus the crisis or the statistics. And a lot of times when you look at overdose and overdose death numbers, it's really easy to get bogged down with how big the problem is. But you guys, especially the ROPES program over the last 7-8 years, have achieved some incredible numbers. Talk a little bit about the successes that you've seen there.
Yeah, so the program was started in 2017. And since program inception, we have distributed over 1 million units of naloxone. And a unit of naloxone is 2 doses. Yeah. And so we know that that is directly related to those overdose reversals and that those statistics of overdose numbers coming down. So we have recorded or reported over 100,000 reversals. And we also know that that number is really underreported, because if you've recently overdosed, are you going to log into a state website and tell people that you have overdosed? No. So we really believe that that number is significantly higher. But even that many people, that's Neyland Stadium right there, is huge. And then I think kind of on a larger scale, when we look at the Department of Health data, what we see is from 2023 to 2024, the provisional data is showing us about a 30% decrease. And so we see ourselves coming much closer to that 2019 pre-fentanyl number. And as a person who oversees programs like that, I'm really proud of that, because fentanyl is still around, it's still doing that, and we're still seeing those numbers coming down. So that means that what we're doing is making an impact, is saving lives, is keeping folks in the community.
And alive for tomorrow. Like
alive for tomorrow.
I just want you to see tomorrow. Yeah. What is next? What's on the horizon? What's on the radar?
So we are really excited. We have been building out our care coordination program in South Central. That was kind of our pilot site, and over the last year, and then we've got some more regions coming on board in the next couple of months. So we're really excited to build out that peer support part of our program. We also know that folks are not going to the hospital and getting connected to services in other ways. And so first responders has been one of those opportunities for us to help people who were not getting connected through all the other programs and services that are out there. And so we're really excited to see that program grow and to take off. And really, the pilot program that we have done has showed really great results of folks getting into services, maintaining sobriety, and even when it's a return to use, they built those relationships with care coordinators for them to reach back out and say, hey, I've returned to use, but I'm ready to get back into services. And I think that is a powerful testament to why this work matters and the impact that we have. Not that I do, but these providers in the community doing incredible work day in and day out.
Yeah, that's awesome. So I'm watching this video. I am mildly aware of fentanyl. I've maybe heard some things that aren't based in reality. They're not in. They're more designed to scare me. I want to learn more. I want to bring a training to my workplace or to my church group or to my Kiwanis club. How do people get in touch? How do people reach out for more?
So the regional overdose prevention specialists are that point of contact in communities across the state. So we have ropes that cover all 95 counties, and they are going to be that point of contact. So they can come out and do a training. They can also get people connected to those other resources, prevention and otherwise, in the community. The other thing that we have been doing for about, almost 4 years now, is these trainings, these virtual trainings once a quarter with Dr. Brian Winbigler. He's a pharmacist, and so you can log in for free, take an hour-and-a-half training. Brian does a fabulous job of bringing that information down to layman's terms, so it's not for medical professionals, it's not for scientists. It's okay, what does this mean for the person in any role that someone watching this video would be able to see. I will say I've sat through Brian's trainings for years now, and every time I still learn something new. He makes that information really approachable and actionable. So we would love to have folks jump in on those trainings. All of those information and training links and all of that are available on the departmental website with our fentanyl resource page.
Oh man, it's available on the department website. Oh wow, wow. okay. We'll put a link in the video and in the description, all that sort of stuff. That's really cool. What else should I know about this work? What else are you jazzed about?
There's always so much going on, and it's hard to pin
Right.
down what it is. We are really excited. We've been working with some folks to do to build out some trainings for young people around fentanyl.
Oh, cool.
And so we know that that's certainly a concern out in the community, and most of the folks dying from overdose are active substance users. But we do know that there's a certain percentage of young people who are experimenting in high school and in college young adult circles. And so we've been building out materials that are directly relevant to young people. It talks about the science of brain development and how malleable that is in young adulthood. And then my favorite part of that training is we talk about dopamine hijacking. It's how do you, what's happening in the brain when you're using substances? And then we talk about healthy alternatives that give you similar sensations with that. And so we're really excited to kind of build out that work specifically around fentanyl with our high school and young adult population. So the coalitions have been doing that work for years, but we've worked with a consultant who specializes in this, and I think we've got some really great materials out there.
Wow, that's awesome. That's awesome. Okay, so the hard part is over. Or no, wait, the easy part is over. The hard part is just beginning.
Okay.
All right, we're playing 5 questions.
Okay.
5 questions with Cate Faulkner. How did you come to join Team TDMHSAS? How'd you get on with the department a little more than 5 years ago?
So at the time, I was working with a departmental contracted provider and was really realizing that the direct service work was not my jam. I have a tremendous amount of respect for people that do it, but it was not where my calling was. And so I knew that I wanted to stay involved in the work, but I wanted to do it at a different way. So I had a friend who was working for the department at the time, and we were just chatting, and she said, "Hey, I think this might be a really good jump for you." And at the time I was like, I don't know about like state administration and all of that. And she said, I think you should have some conversations with some folks. So I had some conversations, and that's been 5 years and I haven't looked back. It's been such a wonderful experience. It gives me that feeling of being able to make an impact and to be involved in the work, but to do it from a big scale, which I wasn't able to do when I was working one-on-one with clients.
Yeah, that's awesome. That's awesome. Okay, second question.
Okay.
What is an experience, personal or professional, that shaped who you are and still influences you today?
So when I finished my master's degree, I took a job in Chicago, and I was working in communities. When you hear about gang violence in Chicago, it was one of those communities. And so I was day in and day out in these communities that were being impacted by community violence. I had kids that had these horrifically traumatic experiences. And it was so formative to me because people had so much going on, and yet there was so much joy and so much resilience in these families, in this community organization that I was working in. And so it has provided me really a framework to think about how people experience really horrific things, and still find joy, still find connection, still find meaning, and the ways in which people carry so much with them, and also keep moving forward.
Yeah, the human spirit, right?
Yeah, absolutely.
Yeah. All right, question 3 of 5.
Okay.
Who is someone who inspires you?
Ooh. So I have been following an activist and a writer, and I have really been enjoying thinking about the ways in which we build community, and the ways you do that in the context of kind of political worlds, but then also just day-to-day life. And so I think that's been a really inspiring journey to watch this activist reading, and reading the work that she does. I also specifically love her work around what she calls loving correction, of like, how do you repair relationships? How do you adjust course in ways that are healthy and meaningful and create deeper relationships rather than fragmented?
Yeah.
So,
or superficial.
Yeah,
that's awesome. Isn't that what we're all searching for, like meaningful connection and that sort of thing? All right, question 4 of 5. What is the best part of your job?
This one's easy. It's working with our providers. I joke that I spend most of my days doing spreadsheets and emails. And when I see one of them picking up the phone to call me and tell me about something that's happening or to problem solve and do technical assistance, I love hearing from our providers. They're the ones that have this passion and this energy and this connection to their communities, and being able to kind of walk alongside them in that process is by far my favorite part of this work.
Yeah, right on. All right, last question. What are you excited about?
I'm really looking forward to the holidays this year. So I have an almost 2-year-old. So last year he had no interest in the holiday sorts of things. And I think this is going to be the first year that, he's really excited. I'm also getting to spend Thanksgiving with my grandmother. She turned 90 this year. And she is thrilled to cook Thanksgiving dinner. I think we're all going to help.
90-year-old grandma's gonna cook? Oh, man.
And she's a good Southern grandma, and like the whole thing, the 5 pies to go for 5 people, it'll be great. So I'm really looking forward to the holidays and being with family and seeing my young kid really jump into the festivities and enjoy that in a whole new way.
That's awesome. That's awesome. Well, Cate, thank you so much for the time. I have learned, I feel like I already knew you, but I've learned so much about you and who you are, and it's just been such a pleasure to hear you talk about your programs and who you are as a person. So thank you for this.
Thank you for the opportunity. I love it.
Yeah.